Hello, I'm Kino and I'll be presenting Week 5 Ophthalmic Case Study. Chief Complaint and History of Present Illness. Miss M.A. is an 84-year-old retired Cuban professor who presented to the clinic with complaints of right eye pointing out for a while now, without associated orbital pain, pressure, loss of vision, shadows, or floaters. She denied aggravating or alleviating factors, and she denies it being a hindrance to her ADLs. Miss M.A. also denied head trauma or pre-syncopal episodes. She also denied fever, rigors, nocturnal hyperhidrosis, unexplained drastic weight variances, edema, falls, headaches, hematemesis, chest pain or angina, shortness of breath, cough, abdominal pain, pelvic pain, dysuria, back pain, myalgias, depression, and anxiety. Review of symptoms, expanded problem focus. Further data from the review of symptoms revealed that she denied HEENT-related symptoms except for stating that she has been wearing glasses for nearsightedness since she was in college in Cuba. However, she also denies congenital eye defects or surgeries, and she also denied cataracts or glaucoma. According to Miss M.A., she first noticed her right exotropia about 10 years ago and has since been seeing her current ophthalmologist, but she stated that although he is Spanish-speaking, she does not know why her eye has been getting worse. She added that the last time she got her eyeglasses prescription changed was about 2 years ago. Other subjective data that pertains to Miss M.A. includes a past medical history of hypertension, chronic obstructive pulmonary disease, gastroesophageal reflux disease, colon cancer, breast cancer, depression, and acute kidney injury. Family history includes her being the only child. She stated that she fled Cuba, leaving her parents there, and she does not recall if they had any chronic illnesses. Surgical history includes a hemicolectomy on 2012 and left breast mastectomy in 2013. Social history includes her denying alcohol, smoking, or illicit drug use. She lives with her 32-year-old grandson who helps take care of her, and she denied any financial, sexual, or physical abuse. She stated that the medication she's taking includes aspirin 81 milligrams daily, famotidine 20 milligrams daily, citalopram 20 milligrams daily, carvedilol 12.5 milligrams twice a day, tramadol 50 milligrams every 8 hours as needed for pain, and amlodipine 5 milligrams daily. Furthermore, she denies any medication or food allergies. She is current on the flu and pneumonia vaccine. Expanded problem-focused physical exam, as was similarly done in the review system, included general survey, head, eyes, ears, nose, and throat, heart, lungs, musculoskeletal, neuropsychiatric, hematologic, and endocrine examinations. Physical examination results were within normal limits for her age and sex, except for right eye ptosis, uncover test positive, or right eye exotropia, which was correctable with the left eye covered, myopia, which was also correctable with her corrective lenses or glasses, EOM test, which revealed right eye exotropia that was correctable upon medial gaze, cranial nerves 2, 4, and 6, possible deficits pertaining to her right eye exotropia, bilateral fundus examination or inspection was non-optimal due to her small pupils, but bilateral arcocinalis was also noted. Musculoskeletal assessment was positive for crepitus to her bilateral knees, which was associated to her osteoarthritis. She uses the front wheel walker to ambulate safely. Differential diagnosis for Ms. MA's presentation and examinations includes mechanical exotropia of the right eye, secondary to orbital muscle fibrosis, versus thyroid myopathy, versus secondary exotropia due to uncorrected anisometropia. Exotropia in strabismus. Strabismus is a deviation of one eye compared to the other eye when looking straight ahead or at an object, which may result in loss of binocular vision or clarity of vision. Esotropia is the inward or medial deviation of the eye, whereas exotropia is the outward lateral deviation of the eye. Causes for exotropia may include infantile exotropia, which occurs in children under 6 months, acquired exotropia, which is subdivided into intermittent, acute, and mechanical, Secondary exotropia is divided into sensory and consecutive exotropia. Intermittent exotropia occurs mostly, or 50%, in patients 1 through 4 years old and has variable episodes of exotropia and normal alignment of the eyes. Acute exotropia usually occurs in adults and can be from multiple underlying diseases such as neoplasms, myasthenia gravis, multiple sclerosis, ophthalmoplegic migraine, hypertension, chemotherapy, sinus disease, and diabetes, to name a few. Mechanical exotropia is due to mechanical torsion caused by tightening or fibrosis of the orbital muscles or thyroid myopathy. Mechanical exotropia can also occur in a rare disease called Duane syndrome, in which there is innervation abnormalities of the ocular muscles, resulting in no adduction of the orbital muscles. Secondary sensory exotropia is usually due to uncorrected visual acuity problems, such as anisometropia, or when one eye is worse than the other. Consecutive exotropia may occur after corrective surgeries from esotropia or exotropia. Based on the subjective and objective findings, the most probable diagnosis is secondary sensory exotropia due to uncorrected anisometropia. Exotropia treatment guidelines. The Agency for Healthcare Research and Quality in 2012 composed treatment guidelines for esotropia and exotropia. However, the guidelines were mostly focused on the pediatric population. The recommendation for exotropia treatment include eyeglasses to correct uncorrected vision acuity problems, and stating that extraocular muscle surgery is associated with secondary consecutive exotropia. In Ms. MA's case, follow-up appointment with her ophthalmologist is needed so that she can clarify the plan of care and voice her concern regarding the progression of her exotropia. Exotropia plan includes follow-up with ophthalmologist and/or refer to another ophthalmologist to get second opinion. She may also need new prescription eyeglasses. 2. She may use an eye patch over her left eye to train her right eye ocular muscles. And 3. Return to the clinic after ophthalmologist appointment. Exotropia patient education includes Ms. MA to seek emergent care if sudden onset of orbital pain, pressure, blurriness, vision loss are present, and have someone call 911 as it may indicate acute angle glaucoma, retinal detachment, or some other acute eye emergency. She may use the eye patch to her left eye, preferably after consulting with her ophthalmologist. Due to her hypertension and type 2 diabetes comorbidities and also obesity, she should continue her dietary modifications, which could include substitution of complex carbs like whole wheat bread, brown rice, quinoa, and also maintaining a blood pressure log to see the average of her blood pressure at home. The plan of care was also reviewed with the patient, and the medication indication, risk, and benefits was also reviewed with the patient.